Hi, my name is Dr. Aaron Boonjindasip. I'm a general urologist at Urology San Diego, located here in Oceanside, California. Today, I'm going to talk to you about a condition common to both men and women, bladder overactivity. Let's start off by reviewing the anatomy of the urinary system. Blood is filtered by two organs located in the back of your body called kidneys. Kidneys filter the blood and make urine. Urine are passed down the ureters, the yellow tubes located on the schematic here, down to the bladder. The bladder is a spherical organ made out of muscle that passively accepts the urine and stores the urine. The bladder will passively retract as well as contract based on nerve stimulation. The bladder can usually hold around 300 to 500 cc's of urine, or roughly 15 ounces of fluid. During my presentation, I want us to think about three things. Number one, are my bladder symptoms normal? Meaning, is this something that I have been dealing with for a long time? Is this something that is new? Are there any other symptoms, including pain and or blood associated with my urinary symptoms? What we really want to see is, am I urinating too frequently? Am I urinating more urgently, meaning having to make it to the bathroom without any warning? Or am I having to get up more often at night? Secondly, we want to know, how bothersome are these symptoms? Meaning, is this affecting the way that I usually want to live my life? Is this cutting into activities that I normally enjoy? Or is this something that I have to plan my life around? Thirdly, we want to know, what are my options if any of these urinary symptoms are present? So you may ask, what is normal? What is a normal urinary symptom profile? First of all, we want to see how many times you're urinating during the day. Most people will urinate 4 to 8 times per day, dependent on your fluid intake, also dependent on any other medical problems that you may have. So it's very important that you are evaluated by a primary care physician and or a urologist to ensure that you have normal and or abnormal symptoms. Secondly, do you have to go to the bathroom now? We want to know what your level of urgency is. If you do have to use the restroom very urgently, that may be an issue with your bladder, number one, not emptying properly, or having an overactive bladder. Thirdly, are you planning activities or organizing your life around your urinary symptoms? That is letting us know that your bladder is running your life or controlling your life. That's not what we want. We want to make sure that you have complete control over your activities and or your life schedule. Next, are you having to minimize your fluid during the day, or do you have to stop drinking because you feel that that is causing more urination issues? That may mean that you do have an overactivity of your bladder. Obviously, we want to make sure you're hydrating appropriately, so this is something that you should bring up with your urologist. Lastly, am I wearing pads? Is this something that is causing me to leak urine or to lose control of my urine? That's telling me that this is a severe problem and that you may benefit from some type of intervention. So how can the bladder affect our life? It can affect our life through inability to work or ineffectiveness of our work if we're getting up to urinate very often. Next, we want to see how well you're sleeping. Are you waking up a lot to urinate? More than 3 to 4 times per night is probably too many times to urinate. 1 to 2 times is permissive, but 3 to 4 times is probably too many times. Is this affecting the way that I can exercise or have a social life? If this is something that is not allowing you to leave the house or to plan trips, activities, or other social events, this may be something that we want to treat. If you are having symptoms, I want you to know that you are not alone. 37 million adults do have some type of overactivity of their bladder. Some people chalk this up to old age. Some people chalk it up to, this is how my bladder is at this time, not knowing that there is treatment out there for their symptoms. As many as 30% of men, as well as 40% of women, have some type of overactivity of their bladder. Therefore, you are not alone in feeling that you have symptoms. Lastly, I want you to know that most people don't ask for help, meaning that they live with these symptoms, which may cause a decrease in their quality of life. We want to make sure that you are evaluated appropriately as well as treated appropriately if you do have any of these issues. Bladder overactivity is a very common issue. About 1 in 6 people do have issues with this, and it's something that, like I said, not always treated with people. So we went over the anatomy earlier. Now we should discuss how does your bladder work. So as we discussed earlier, your kidneys make urine that's filtered down to your bladder. Your bladder passively stores the urine. Once it gets to a certain point, it tells your spinal cord that, hey, I'm full, I need to empty my bladder. So the spinal cord will send a signal to the bladder to allow it to empty. Sometimes those nerve stimulations may be deranged and can cause an issue with overactivity. That's what we need to understand as urologists, is where there is problems, meaning are there problems with the bladder or are there problems with the spinal cord? This will allow us to further evaluate the patient as well as to treat them appropriately. In the schematic seen here, you can see what a normal bladder does. Normal bladder will fill with urine appropriately to a certain set point, like I said, usually about half a liter, and it will tell the spinal cord that it needs to empty. In a bladder that is overactive, it will not fill all the way. There is a new set point that is reached, and the muscle, the detrusor muscle, will contract before the bladder is full, allowing the patient to feel the need to use the bathroom. This also leads to incontinence, where the bladder will contract without the patient knowing it. So you may ask, what are the things that may be causing my bladder to be this way? So when a patient is evaluated for these symptoms, we try to find any outside causes of these symptoms, meaning is it something that we're eating? Is it something that we're drinking? Is it something that may be irritating the bladder, maybe medications and or an exogenous source? So we go through a detailed history with the patient to ensure that we understand the patient's lifestyle, to ensure that we know what medications and or medical problems the patient has so that we can fully treat the patient. It could be previous surgeries that we had in the past, injuries and or pregnancies or childbirth. Lastly, it could be medications that we've taken in the past or are currently taking that may cause an increase in urine output or a sensitivity or irritation of the bladder. Secondly, we will perform a physical exam where we identify the patient's anatomy. For a male, it may include understanding the prostate size as well as anatomy. For a female, we may do a pelvic exam to see if there are any signs of vaginal atrophy and or pelvic organ prolapse. These can cause urinary issues as well, and these should be treated concurrently if there is any overactive bladder symptoms. So what is overactive bladder? How can we define this? This is usually a symptom or a constellation of symptoms that lead to urinary urgency and urinary frequency. So to define what urgency and frequency is having to use the bathroom more than 8 times per day. It is a feeling where your bladder is not completely emptied, even though it is empty all the way. This may lead to nighttime frequency, or what we call nocturia. Urgency is the need to use the restroom now, where you have to make it to the bathroom uncontrollably to empty your bladder. Incontinence is the leakage of urine where you cannot control it. Either this can be related with urgency, meaning that you can't make it to the bathroom in time, or it could be related with movement called stress incontinence. That usually is secondary to multiple childbirths and or pelvic floor changes. So some of the myths about OAB or overactive bladder is that this is a normal change as we get older. This does not have to be normal, and a lot of times it can be abnormal. It's very important that you see a urologist to evaluate whether or not these are normal changes or if there is something that needs to be treated. Secondly, OAB is thought to be a female disease. These symptoms could be experienced by both men and women, and it's something that should be evaluated, again, by a urologist or primary care physician. Thirdly, OAB is not just an issue with the prostate. Prostate obstruction may cause some of these symptoms, but if properly treated, urinary urgency and frequency should be dissipated. If they persist, then it could be a remodeling of your bladder and persistent changes to your bladder that could be causing these issues. Therefore, symptoms can be treated with either medication or other types of modalities. It's important that you understand that surgery is not the only treatment for overactive bladder. There are surgical treatments, but most people are treated with lifestyle modifications and or medication. Please see your medical professional for evaluation. I'd like to start by going over the lifestyle changes that can help us with our overactive bladder. We can try to take out some of the foods as well as drinks that can cause these issues. Some of the foods and drinks that can cause overactivity include caffeine, including tea and coffee, sodas, drinks with dyes in them, tomato-based foods, foods with citrus, as well as potentially chocolate. Now, we're not telling you to take all of this out of your diet, but it's maybe something that we have to modify. If there is a direct correlation, then we can potentially change things without putting patients on medications or other modalities. It's very important that you keep a bladder diary. Some of the things that we'd like to see is how many times you're urinating during the day, how many times you're getting urgent episodes, are you leaking any urine, as well as how many times you're getting up at night. If you are leaking, it's very important that we know how many pads and or diapers you're using a day. It's very important that we know if there are any associated symptoms, meaning pain and blood. We want to make sure that you're emptying your bladder all the way. So one of the techniques that we do employ is something called double voiding. So when you are at the toilet, it's very important that you try to empty your bladder all the way, meaning that you take the time to relax and make sure that your bladder is emptied all the way. If your bladder is not emptying all the way, it can cause some of these symptoms that we're talking about. Lastly, we use pelvic floor exercises for some people who have urinary symptoms. A lot of times we have to use relaxation techniques to allow the patient to empty the bladder all the way and or to minimize the tension that can cause urinary symptoms. Some people may benefit from pelvic floor exercises called Kegel exercises. These actually strengthen the pelvic floor and very important for people who have stress and urinary incontinence after procedures, childbirth, and or other pelvic floor insults, as well as people who need strengthening after injury. Medications are a mainstay treatment for overactive bladder. They can range from an older medication called oxybutynin to a newer medication called Myrbetrix. The older medications are called anticholinergic medications. They're very good at relaxing the bladder, but sometimes they can have other unwanted effects. And those effects include dry eyes, dry mouth, or constipation. The newest medication, Myrbetrix, is a different class of drug called a beta-3 agonist, which can help with relaxation of the bladder as well. It's very important that we try to find a good regimen of medications as well as a cost-effective regimen of medications to help you with your symptoms. The next modality I like to talk about is something called bladder Botox. You've probably heard about Botox in a cosmetic sense, where people inject it into the muscle of the face to minimize wrinkles. What we've seen is that we can inject it into the muscle of the bladder to help minimize the bladder from being overactive. Same thing with the face, it helps relax the muscle, the detrusor muscle of the bladder, to minimize the contractions that can cause the overactivity of the bladder. It can also help people to store urine to allow them to go less frequently as well as have less nocturia at night. This medication usually lasts about 4 to 6 months. It's injected either in the office with local anesthetic or under slight general anesthetic at a surgical center. The risks of this procedure is very low. The thing that we'd be most worried about is that it can work too well where the bladder does not empty all the way. So it's very important that you follow up with your urologist to ensure that your bladder is emptying after the injection of this medication. The last treatment is called nerve stimulation. We have 2 types of nerve stimulation. One is something called percutaneous tibial nerve stimulation. This is a modality where a needle is placed into the lower part of your leg. And electrical stimulation is brought to the spinal cord to help modulate the nerve signals to your bladder. It does mean that you have to come in once a week for 12 weeks, but we do see improvement in select patients. Lastly, we have an implantation of a neurostimulating device. This procedure is called SACRAL neuromodulation. It can act as a pacemaker to the bladder. It is an implantation where a lead is placed into the nerve that goes from the bladder to the spinal cord. That signal, or the relay of signals, is modulated to ensure that the bladder has proper signaling to relax as well as to squeeze and expel the urine. This can be a staged procedure while a trial of an electrode can be placed for a week or two to ensure that the patient has improvement of their urinary symptoms. If the patient does have improvement, then we will place a small implant into the lower back that will help with the patient's urinary symptoms at all times. For patients with moderate to severe urinary symptoms, this is a very good choice. Again, not all of these treatments will be perfect for everyone. Sometimes we will need to use a combination of these treatments, or we need to kind of figure out which one works best. All in all, it's very important for you to be evaluated by your primary care physician or urologist to ensure you are on the right treatment to help minimize these symptoms. These are quality of life issues, but sometimes there is an underlying disease that may need to be treated that could be severe. So we want to make sure that we can rule that out first. Thank you very much for your time. If you have any questions or concerns, please make an appointment and we'll be very happy to help you with your issues. Thank you.